Okay, thanks, Victor. Let's bring in our friend, Dr. Ashish, Dean of the Brown University School of Public Health. Dr. Jha, welcome back again this morning. We just heard Dr. Fauci say that the CDC might be considering revising its mask guidance. Do you think that's a good idea?
Good morning, George. Thanks for having me here. I think it'll help. The issue really at this point is what are Americans willing to tolerate? And are Americans going to be willing to mask back up again? It can be a temporizing measure. What we really need is a lot more people vaccinated. That's how we end this thing.
That's how we end this thing. How about schools, though? We know schools are starting, school districts starting as soon as the next couple of weeks. Should they be rethinking vaccine and mask mandates?
Yeah, I think, for kids under 12 who have not gotten vaccinated, especially if you're in a zone with a lot of infections happening, I think masks can make sense as part of a broader set of things. For older kids, for people who are vaccinated, imagine a room full of vaccinated older kids and teachers, it probably is less necessary. I think it's going to be a community decision.
One of the biggest things holding people back from taking this vaccine right now, it appears, is the fact that you still only have emergency use authorization for the vaccines, not full authorizations. Why is it taking so long? How much of a difference will that make?
So first of all, I think it'll make an enormous difference. I think for a lot of people who are on the fence, it'll help them jump off that fence. For I think a lot of companies that want to mandate this so they can bring workers safely back, it'll help them. I think a lot of us are baffled at why the FDA is taking so long. I mean, typically it does take 6 to 12 months for the FDA. These are not typical times, and the data is overwhelmingly clear. The FDA is going to fully approve it. They should just move forward a bit faster right now.
We're seeing this surge right now. How bad is it going to get?
I'm worried, George, that it's going to get much, much worse. We're still in the early days of this surge. Right now, we're generating about 50,000 Americans getting infected. That number could easily double or triple. We've got a ways to go before it really peaks and starts coming back down.
So we have to get those vaccines up.
We have to get those vaccines out. There is no other way this pandemic comes to an end.
Dr. Jha, thanks for your time and your information this morning.
Thank you.